Stress is a word filled with negative connotations, often associated with the emotional responses to distress, feelings of dread and anxiety, lowering performance, which can lead to more serious implications on mental and physical health. However, stress can also be positive and is known as eustress, which can be beneficial, being a catalyst for increased performance as excitement manifests as increased energy, focus, and motivation. All stresses can be determined as internal from assumptions regarding various situations based on personal belief and experiences. This stress is self generated, or external, out of personal control from the environment. This can range from minor inconveniences to major life changing events. Everyone experiences stress, and the body is equipped to manage stress, and it can be essential for survival when the response is healthy and proportionate. Common sources of stress include day-to-day stressors, frequent low-level mundane pressures which can be disruptive, such as work or educational concerns, navigating relationships, and other responsibilities that are routine that add to our stress levels. Unexpected negative stressors are unforeseen events exceeding regular coping capacity. Stress levels increase abruptly. A serious accident at work or on the road, financial struggles, and family breakdown are examples of these stressors outside the daily expected parameters. Increasing demand on emotional and mental energy levels, which can impact our daily life. Stress related to trauma is a significant event that an individual experiences, such as abuse, physical assault, incidents of warfare, or disaster. This often leads to emotional extremes of either being overwhelmed or the numbing of emotions. This can lead to post-traumatic stress disorder, nightmares, flashbacks, and can have long-term health implications. Those who experience this as a child often have a harder time regulating their emotions. Acute stress comes on quickly, can be impactful, but is short-term, such as an exam, an interview, or an argument. This can become episodic when acute stress occurs frequently and a person is unable to return to a relaxed state, often experienced by healthcare workers. Chronic stress lasts for extended periods of time. Financial instability, relationship breakdowns, work overload continuing for weeks or months. Symptoms can be difficult to detect, which can lead to long-term mental and physical health problems when unaddressed. Personal problems, including relationship difficulties, arguments, setting boundaries, or feelings of loneliness. Life-altering events such as new work opportunities, relocations, or losses can be challenging. When an adjustment is forced, it is essential to manage the emotional toll. Physical and mental health have long been identified as linked, each having a significant impact on the other in both short and long-term instances. The impact of stress is individualised. Identifying stressors and the levels of stress being experienced helps manage health mentally, physically, and emotionally. Seeking help and support when it is needed is crucial. When experiencing stress, which can be short-term or long-term, individuals can display signs and symptoms that can be cognitive, physical, behavioural, or emotional, varying in severity. Cognitive symptoms include concentration problems and difficulty remembering or making decisions, can develop dementia when routine stress is too overbearing, with problems to self-confidence and feelings of worry. Physical symptoms include headaches, which are notable for handling routine stress and personal stress, with work and financial concerns, leading to potential dizziness and fainting. Inflammation is often a symptom of routine stress. Muscular pain and tension, also seen in routine stress, doesn't allow the muscles and mind to relax. Digestive issues such as nausea, diarrhea, which is intensified whilst navigating personal stress and sources. Cardiovascular issues, including an increased risk of heart disease and heart attacks associated with most sources of stress, such as routine and personal. The skin can react, causing eczema, and this can also impact on sex drive, as in men, production of testosterone is affected, impacting sperm creation and maturation, or even erectile dysfunction. And women are impacted in their estrogen levels, affecting natural cycles, which are with a potential of premenstrual syndrome irregularities. Increased blood pressure increases the risk of stroke, which is often associated with high routine stress levels for prolonged periods. Fatigue and lack of motivation for exercise and other bodily functions are affected, impacting the natural immune system. Panic attacks affecting the respiratory system with shortness of breath or fast breathing, exacerbating respiratory disorders. Accelerated aging of cells such as skin and decreased bone density, increasing the risk of fractures. Behavioural problems include disruptive sleep, including insomnia, and changes to eating patterns. used as a coping mechanism for routine stress, which can lead to weight gain and an increased risk of obesity and an increased risk of diabetes or even anorexia. Withdrawal and low self-esteem, disconnecting from society, family, friends and social circles. Undesirable habits such as nail biting, fidgeting, pacing, often from agitation or nervousness. Increased use of substances, responsibility neglect, performance neglect, and avoiding triggers is a common with traumatic stress, which impacts daily life. Emotional includes low morale, mood changes and increased irritability, unable to relax, seen in those with increased weight loss caused from personal stress. Feelings of helplessness, depression and anxiety are often symptoms of traumatic stress, as well as managing personal sources of stress, leading to feelings of overwhelmed, unhappiness and guiltiness. Experiencing stress during pregnancy can also impact the growing fetus, being associated with emotional dysregulation, ADHD, behavioural issues and cognitive delays. Anyone who experiences any type or source of stress can experience any number and combination of these symptoms. It is important to be able to identify and manage stress effectively and seek support when it is needed. It is essential to utilise coping strategies and mechanisms to minimise the impact of stress and preserve health and well-being. Coping strategies can be healthy and unhealthy, but the first and most important step is to identify the cause. Failure to do so could only give temporary relief or make a situation worse, as the root cause is not being addressed. It is vital to take control of the situation and challenge yourself. Writing down clear goals in a plan of action can be empowering, giving back control and a sense of direction by providing more manageable ideas to encourage and maintain motivation. Make time for yourself. Do activities you enjoy, socialise and relax, which could be calming exercises such as deep breathing, meditation or physical activity. This can help with clarity and lower the emotional intensity, as exercise releases endorphins, increasing mood and energy levels and facilitating restful sleep. This can also have a physical impact, lowering blood pressure and heart rate as the body and mind relax. Regular use enhances overall health. Connect and socialise. Having a supportive network with friends, family, colleagues, etc. supports and aids mental and emotional well-being, offering new perspectives with appropriate boundaries of what is and isn't acceptable to protect yourself. It is essential to recognise that some thoughts and feelings experienced can be uncomfortable and extreme, such as self-harm, suicidal thoughts and auditory hallucinations, which can be incredibly disruptive to emotional state. It is essential to understand that these feelings are real, acceptable and short-term and do not define us. Managing this can be done by being open and honest and discussing these uncomfortable feelings, which can give power over them. Discussing them with a trusted person or professional allows for the receiving and perceiving of new perspectives. Seeking professional help for mental health specialists who have expertise in this field to offer guidance and treatments in a non-judgmental environment. In cognitive behaviour therapy, an experienced professional assists in the recognition of negative feelings and behaviours and has access to resources to change them into positive actions and emotions over time. Coping mechanisms provide relief, whether immediate or slow over time. Still, all can be classed as either adaptive, a positive, healthy and beneficial strategy that tackles the problem and source of stress, or maladaptive, short-term relief in a negative way that masks the problem or ignores the root cause. The category in which it is placed is dependent on the context and circumstances during the use and the impact of a strategy. When developing coping strategies, these are either emotionally focused, which give better responses to stresses, or problem focused, which modify and limit the source of the stresses. The effectiveness of a coping strategy varies on personal circumstances, characteristics, experiences and perspectives of the user, as well as the circumstances it is used. That's why it is essential to be open to new things when trying to curate a personalised plan in managing the effects of stress on physical, emotional and mental well-being, as the effectiveness of the strategy can only be measured by the quality of life it gives the user, meaning a level of understanding of personal stresses is required, and accepting that his natural response can intensify for any number of reasons, affecting the efficiency of the strategies. Incorporating such things as balanced diet and exercise into a daily routine can improve self-awareness and greater emotional control, which improves resilience in the long run and aids in chronic stress symptoms. Using things such as deep breathing, meditation, and progressive muscle relaxation techniques can help achieve focus and clarity and can assist in handling acute stressors.